Welcome to the Mindful Table Talk with Health Empowerment Coach Joanna Mickel and myself, Maame-Mensima Horne, naturopathic doctor and clinical hypnotherapist, where we discuss natural approaches to health and wellness with an emphasis on being mindful. Today's episode, we will continue our conversation on mind-body medicine. So, over the last couple of weeks, I decided to do a little bit more digging to really try and find a collective definition on mind body medicine. And I have to admit that there really isn't, except for therapies that connect the mind and the body. So that could be the emotions and physical sensations. It can be stress and physical sensations, physical symptoms, psychosomatic disorders. So there's so many ways to define mind-body medicine. And it's also a field that if you were to say just Google it, it will come up with different branches of medicine, like Chinese medicine, acupuncture, yoga, homeopathy, meditation, these fields and some tools, but not a specific definition. So, Joanna, for you, how do you define mind body medicine?
Well, for me, mind body medicine is holistic medicine, right? Coming from, I've been sort of trained in naturopathic medicine for a couple of years, and then I switched over to Chinese medicine and acupuncture. And in Chinese medicine, there is no separation of mind body. It's all encompassed in the therapies, or in the diagnoses, Chinese medicine diagnoses. It's part of the symptoms, part of the etiology, part of the pathology is being aware that there is the shen and the body and the little shen. So they have the big shen and the little shen and then the body, which in Chinese medicine is the mind, and then you could say the soul and the body. So in Chinese medicine, there's no separation. Of course, we understand that separation of mind and body happened about the time of Descartes and Newtonian physics and all that stuff. Kind of, we could say, in the Enlightenment period, which to me wasn't really enlightening anything. It was actually kind of reductionist view coming in, and so they kind of put the mind over in the spiritual aspect and left it in the avenue of the church, and then the body was considered science, and so you put it over there, not recognizing that it's together. They're starting to recognize, oh, you can't separate that. And so then we created this kind of concept of mind body medicine. And that's why we aren't able to find, a definition for it. And, a lot of more of the traditional medicines, are considered mind body because they take the mind as a whole with the body to say it has a role play in etiology and pathophysiology of health and disease development, and then of course in how you help to bring back the body into wholeness and health and wellness, which wholeness we know is in natural medicine is where we get to the point where true health and wellness is in the wholeness of the individual.
Yeah, thank you. No, that's a
Yeah.
great explanation. And I know that you keep bringing up Descartes. And like that was like in the 1600s
Yeah.
when the separation happened, and the separation has stayed specifically in Western medicine for a
Mm-hmm.
very long time. I know that, so I mentioned this book, Dr. Rossi. He worked with Milton Erickson
Mm-hmm.
like in the I would say in the 1970s, and they were talking about research that was happening at that time that was specifically on the mind body medicine. And what they found, or what he talks about in his book, The Psychobiology of Mind Body Healing, he actually talks about how research at that time was supportive of not just, he was a practitioner of hypnotherapy and hypnosis
Mm-hmm.
for therapy, or therapeutic hypnosis is what he called it, but also the relationship between yoga, meditation, and prayer. And
Mm-hmm.
what the chapter, because I was reading, it was talking about stuck state memory. So if we're looking at a person who has trauma, and that trauma essentially presents as a shock. So when there's a trauma or a shock to the system, to our bodies, to our minds, we kind of get stuck in a pattern in that moment, in that shock
Mhm.
state, whether and the emotions. So there could be sadness and grief, it could be anger and frustration, it could be like
Mhm.
shame, guilt, whatever the emotions are that are happening to that at that time of that shock, the
Mhm.
person kind of gets stuck there. And then we see the nervous system dysregulation. We also see the endocrine dysfunction as a result of these experiences. And what he talked about was how prayer and meditation and yoga essentially work to balance the nervous system and induce a
Mhm.
parasympathetic state.
Mhm.
So to help bring one out of at least fight or flight,
Yeah.
right? So that there is more balance to the nervous system. And so when I was thinking about mind body medicine, what I was thinking about is working at the nervous system level and how a lot of these therapies are
Mhm.
utilizing the state of the parasympathetic state. So taking us out of the fight or flight and bringing us into the rest and digest. And
Mhm.
rest and digest is where healing actually happens. And
Mhm.
there's so many modalities that are able to do that. And it's consciously taking the patient from a hyper or a hypo aroused state into a more relaxed state where they can be present. And
Yeah.
I find for me that that really is, I would say, the thread or the fabric that connects all the therapies that I use that I would consider a mind body medicine.
Absolutely. Yeah, that's definitely what I would see as well in the research I've done. I mean, the and all the different books that I've read on mind body medicine. One of the oldest one, he was from 1940s, I think, when he kind of he was an MD in Switzerland. It's Dr. Tournier. I forget what his
Okay.
first name is. His book is called Healings of Persons, and he was an MD, and he started seeing that emotional piece, like you were talking about, where you got stuck, and so he saw that that was like the root of these people's illnesses. I mean, it could be anything, and to where he actually stepped aside from, you could say, Western medicine and went into a mind body, trying to find where is that stuck emotion and helping them to be able to address it, to put them back into, like you said, the rest and digest. I don't know that he had any specific, because he didn't speak about yoga and all that stuff. His was He was a Christian. His parents wanted him to go into the ministry, and he did not. Um, I think he did get some training in that. So he did talk to them about their spiritual walk, but he never tried to convert them. He just wanted to see if they had a spiritual um,
Really.
basis, which we talked a bit about that on the last episode, how that kind of plays a role in some of the mind body piece if you go really into it a little bit further. But at the same point, he was like, you have to deal with these emotions or you're not going to reset that rest and digest. So
Mhm.
yeah, you have to and really, what is it? Because you have to go to the nervous system, because what the brain and the mind is a part of the nervous system. It's creating those neurotransmitters, the the hormones, because neurotransmitters then go downstream. You got the neuropeptides and then the hormones, that's sending out these messages to the body. So if you don't address the nervous system and stop the cascades that creates the body functions or the physiology that then creates the disease over time, yeah, so you're going to be dealing, these modalities have to hit into the nervous system. And we have the vagal reset techniques that are out there. One of them is just rubbing your ears, which
Yeah,
is very
even
relaxing.
singing, right?
That's a very
Singing
simple
and
one.
humming.
Yeah,
Singing
singing
and
and
humming.
humming, exactly, definitely, yes. Yeah.
Yeah. So that,
Mhm.
like, for me, that's one of the things, like, one of the practices that I do is a chanting practice.
Mhm.
And chanting is also stimulating the same areas, right? Because again, it's stimulating the same nerve, the vagal
Yeah.
nerve. And
Mhm.
I think that's there's so many ways that that is happening, and being able to tune in and find, because there's so many therapies, is
Mhm.
finding practices that align with the person, individual in front of us,
Right. Yeah.
right?
Yeah, it's
Yeah.
definitely because if they don't feel comfortable, they're not going to be able to relax. They're like, "What is this?" And so it's really kind of coming down to, okay, how do we? Which I've read the book by Dr. Andrew Weil, he did MD, and then he found he was not satisfied with his training in Western medicine as a medical doctor. And so he went around the world and studied under several different types of traditional medicine, being in South America. I think he went to China or India and was exposed to all these different traditional forms of medicine, and to where he was able to also see that mind body piece. And in one of his examples, he was talking about this woman who ended up with this horrible rash all over her body, and she couldn't get rid of it. The doctors in the Western couldn't figure out what it was. She was to the point where she couldn't go out in public. She was so disfigured, and she was to the point of almost getting to where she was getting suicidal because she was just so miserable and unable to do what she used to do. And so she somehow got introduced to Dr. Andrew Weil, and he had he deduced what was the issue by asking her what happened at the time that this began. And it came down to, she was having empty nest syndrome, which of course is a psycho emotional reason. So it's something that she has to deal with, that piece. And he says, you need, and he set it up, he says, you need to have hypnotherapy. And and he gave her a doctor he referred her to, a hypnotherapist, to work with her on this issue, and she wouldn't go. He gave her a tea to help with the symptoms, but the next time she came in, it was looking better and she was having less symptoms. But he said, did you go? And she's like, no. And she was having this idea of, like, what they say of hypnotists, and so they think somebody's going to manipulate their mind. And so he had to educate her on what it was like. And so he said, how about just go to a consultation? And so then she realized it was putting him in a meditative state. And then she understood meditation. And then she was able to do the hypnotherapy, and it cleared her up. And she was able to deal with that situation in life. And so, he said, he sits down with his clients or his patients that come in, and he's like, I don't really do the therapies with them. He says, what I learn is how to match them to the right therapy for them. And he did have to, you have to really educate them on some of them. Like with this one, he had to go back and say, this isn't that.
Yes.
And then when she got the connection, then she was able to move forward and get her healing. And so, we have to find what resonates with the client or the patient, and the best way for them to move forward. Because again, that hesitation, especially when you tell somebody hypnotherapy, that first thing they think of is somebody making you act like a dog or whatever, because that's all they see. Instead of understanding it's a meditative walk through somebody. I like to say it's a guide through your memories. It's a guide to memories.
The stage hypnosis of even last episode, and I do want to speak to that because prior to school I had exposure to stage hypnosis. I worked in 2 comedy clubs, and I've got to see it in person. And it's so funny because there are 2 different types of people who are going to go on stage: people who are extroverted and want attention, and then people who are, it's usually the people who are extroverted. The people who are introverted tend not to go on stage. And part of that is that the not wanting to be the center of attention, but to go on stage, you're going to be the center of attention. And so if somebody gives you a suggestion, you're going to go along with it because you're a part of the performance, and so that's one thing that I feel is an education piece, because most people who are going to be volunteers, and even before the show, there is a conversation that is happening where people are being assessed. So it's not, it's a show. It's really entertainment. These are entertainers who have a skill set that they're using for a show. And that gets misconstrued because the people who go on stage, they may not be entertainers, but they are willing to entertain you. They're willing to sometimes do stupid things so that the laugh and the show continues, right? So I wanted to talk about that piece because I think it's important because as a hypnotherapist and someone who's trained in clinical hypnosis, when I talk to people, I'm always having to do that education piece, which is first, hypnotherapy is utilizing the same states as you would find in meditation. And when we're looking at the brain waves, they're similar brain waves. And the difference between, I would say, hypnotherapy and meditation is you have a facilitator, even if you're doing self hypnosis, you're
Mm-hmm.
still going through a process
Mm-hmm.
to induce that relaxed state. Whereas with meditation, you're just trying to focus until you are empty, ideally. Some people it's just like, look, if I could just focus on my breath, I'll follow the thoughts because I did this for a long time. Sometimes I do. That's where I go to get I ask a question and I'm like, oh, okay. Do I get a yes or no? You know, in my meditations, that's where I can get more clarity. That's how I use them. But some people, they want to be empty. And so that emptiness is where, okay, you can be receptive and get the downloads, but you have to like focus. You're focusing on one thing. With hypnosis, you could focus on, you're focused on one thing as well, but it's different. And you're being guided into a hyper fixed and hyper focused state because it's really trying to get that super focus, but you're also focusing on the practitioner. So if I'm guiding you, I will encourage you to listen to me so that your focus and attention is on my voice. And from focusing on my voice, and I don't always have to say, oh, listen to my voice, but that is one way to induce hypnosis so that a therapy and therapeutic relationship can be created and then the
Mm-hmm.
facilitation happens. But yeah, I felt like that distinction has to be made because hypnosis, like literally, is doing therapy in a very relaxed state. That's really what we're doing. It's like if you're it's like bypassing your conscious mind and
Mm-hmm.
allowing your conscious mind to be focused on one thing, which is like relaxing. And then through that relaxed state, we're actually able to tap into the deeper emotions that are underneath that.
Yeah. I call it a guide down memory lane.
Yeah.
You know, somebody taking you on a tour of the things that you need to deal with. Sometimes it's having somebody to hold your hand through the woods of your mind. you know so
Yeah.
that you have a safe space sometimes, really, to be able to deal with that. And because the reason why is it put in the background, right? It's because we're just trying to survive, or there's a fear, there's a you know it's overwhelming. But if you're going with somebody, the overwhelmness can actually be taken away. So it's like you have, like I said, a guide.
Well, it's not
um
that the overwhelm is taken away, but it's having someone who knows how to handle the overwhelm, and also how to facilitate through the shock. Because these are shocking to our nervous experiences that are shocking to our nervous systems, right? That's what trauma is. These
Mhm,
experiences, whether they're big or small, they shocked our nervous system. And the
mhm,
emotions associated with that shock state, they have to be navigated, and the shock simultaneously needs to be navigated when we're
mhm,
doing hypnosis or hypnotherapy
mhm,
specifically, because there is a lot of shock. Hi, Cap.
mhm,
But there is a lot of shock that I know I've had to work through with patients. It's like, okay, like your desire to run away, your desire to dissociate, your desire not to do the work. Those
mhm,
are, yes, protective mechanisms, but they're also signs that there's a shock that you're trying not to go into. So knowing how to facilitate that is, I think, one of the most important skills that a therapist can have.
mhm.
Yeah.
Me.
No, but there's so many other techniques. So I know when we were, so Joanna and I met at, it was then Southwest College of Naturopathic Medicine and Arizona. And we also took mind body medicine classes. And in those classes, we were introduced to different modalities that, or techniques or tools that we can use with patients.
Mhm.
What, like, what did you find are like some of your favorite techniques that you use?
My favorite is, and I don't use it yet because I have to, finish up here. But it's one I still try to practice on occasion, so I still have it in my tool chest, and I'll get the first certification later. We did neuroemotional technique, um, and that's a way that we can tap into our nervous system through utilizes applied kinesiology or muscle testing. And it also incorporates a bit of the five elements of Chinese medicine using pulse points in the body and their association to the emotions. And the body will tell you. So if there's pain in the body, you can see if there's an emotional trigger to it and then find what that emotion is. The body will reveal it through the technique. And then if you're trying to reach a goal but there seems to be something that's blocking you and you're not aware of it, you can actually also use this technique to see what is the emotion that is blocking you from moving forward in your goal, which is pretty amazing as well. So you can see what might be that subconscious. You've probably heard that you self-sabotage your goals sometimes and you don't realize it, and it's from those past traumas or past experiences. So a neuroemotional technique can help you to find what is it that's causing you to self-sabotage on your goals and things. So it both helps in relieving pain, and it's pretty amazing because the reason I do it is because I've seen it work on me in class. I had a migraine, and I had one of my classmates do the neuroemotional technique, and the migraine was gone after the technique. I was practicing on one of my sisters, and she had knee pain for 9 months. Did the technique, it was gone after the technique, and she had even been to her doctor. Doctor's like, I don't see nothing. We can give you some pain meds, and that's about it. And so because they didn't see any physiological issue with her knee. And so once we did that, it was, I was, I was like, oh my, and so she's like, and she started telling people, my sister did this technique, and my knee pain's gone. And so she started seeing the connection between the emotions and the pain in the body. And so it's pretty fascinating, the connection. Again, going back to that idea, you have to hit the nervous system. And of course, your nervous system is going to be the thing that's going to tell you there's pain going on there. And so, so that's one of the techniques that I really enjoy, is being able to help people to bring up those things. And it's, uh, it can, if it gets to where it's an emotion that's really, strong or something that's traumatic, then that's when I would probably then recommend them out to a therapist to deal with that a little bit more. Because I think on some of the more, traumatic ones that come up, I think it needs more than that technique probably can fully handle. But at least it'll get it to the awareness of the individual and say, okay, you can see it now. And if you feel this is something that's going to be really charged, then I would recommend you see a therapist, because this is going to need something a little bit more attention for you to be able to process it, whether it be through hypnotherapy or some other form that really helps a little bit more deeper. So this one's more kind of, to me, gets at least to something known. But if it's something, moderate or mild, they can definitely deal with it pretty quickly. And it's pretty amazing with the quick things. If it's something a bit more traumatic, then that's going to probably need to go on to another therapy. So you have the different levels of therapy too. So that's one of the ones I like. I don't know that I'll ever go into the really deep stuff. I have been introduced to hypnotherapy with one of my programs, but not to the point like you are. It's just, of course, some understanding.
Yeah.
More for hypnosis for minor things. So that's one that I use that I like.
No, that's
Or
awesome.
that.
Yes, I mean, obviously my love ended up being more hypnotherapy because I mean, I love to go really deep into the emotions mainly because I had my own stuff that I had to work through. And as I worked through my own emotional, I guess, distressors and traumas, I've cultivated within me. And I think I also always had the desire within me to be able to hold space for others in that capacity. And what I do find is like there are some things that are really hard for people to sit with or to sit and witness. So for me, it's always been, I really got into the heart-centered hypnotherapy because it was something that I had to work through my own emotional traumas through
Mm-hmm.
that process and the training. And the more work that I did, the more I would say liberated I felt, as I would say emotionally, to be able to kind of, live the way that I do and even make it through. I feel like I wouldn't have gone back to complete the ND had I not. I did have a session with one of my groups. I was doing my internship, and one of the mentors and the leaders facilitating the internship, and I was one of the volunteers for the demo for the weekend. And it was pretty intense because what was coming up for me was, even if I like something, I can love something, but I would let it go I had to, if I felt I had to fight against someone, because I don't like to fight for a thing. No, it's not I don't like to fight for things. That's not correct, because I will advocate and I've always been an advocate, but I'm not going to fight to my own detriment, right? So it's like if I have to sacrifice my well-being in order to be in a space, then I'm not willing to be there. But that came from an experience I had in my childhood in school, where I had teachers, like I was in advanced classes, I was in honors, and we moved to a new school, and I had a teacher who didn't want me to be in the class for their own personal reasons. And so they moved me up to their advanced honors class in the middle of the semester. So I started behind, and then I got a C, and they're like, "Oh, you shouldn't be here." So they put me back in the other class. And it was weird because I that the I didn't have the opportunity to even advocate or fight harder and say, "Hey, okay, like I'm at a disadvantage, give me a chance." The decision was made for me. And so I didn't fight. And when it came to certain decisions, like even with our education, had I not really worked through that and created, so it's like not just working through the emotions, but what I love about the work that I'm trained in is, what am I going to do once I get my new conclusions or like new beliefs, those, like we get rid of some of the blocks, the faulty, they're not, I wouldn't even call it faulty. I would call them, they're conclusions that we made from our wounded child that never got corrected. So they're old and they no longer serve the adult. So as I work through that, it's okay. So now what's the plan?
Mm-hmm.
So I created a plan. Like I love talking to people in power. So in school settings, I was the one. I would make an appointment with the president. I'll make an appointment and not hang out, go visit the dean. I'll go and do those things. And I enjoyed it. But that was a part of my plan. It's like I grew up in an academic home. My mom was a professor. So I didn't see a differentiation between my professor and anyone else. I see them as my friend. And I think you know that because you're laughing. So I would make appointments when I needed to just ground with the deans or whatever. If I had a complaint, yeah, I would go and talk to people who I knew could actually like see me. They would hear me out, whether they'll make a change or not. But at least they would hear me out. And that was like my strategy to make it through,
Mm-hmm.
which is I don't know. I felt like sharing that because it's like those are like we all go through things. And it's how these modalities actually help us to get to the other side, right? How do we become successful people? Or success is very subjective. How do we
Mhm.
be, how are we the best versions of ourselves, the healthiest versions of ourselves, right?
Finding those optimal, like you were saying, faulty programming or thinking or outdated thinking. I like to say it's not an optimal way to approach things. I like, some of the meditation techniques, visualization, journaling, things like that. Those are kind of techniques that people can take home with them, which I share at my coaching, my health empowerment coaching. I empower people to take back their health. That's the goal. I tell them they're the number one healthcare professional because they're with themselves, and so, how can I give them certain techniques that can help them overcome a lot of those programmings that can lead us into stress responses, which then leads us into the issues that we have in health, whether it be type 2 diabetes, hypertension, um, you know, um, depression, the list can go on and on because, again, like you said, it's the nervous system getting in that stress response and not being able to go back. And so I do a whole stress module in my program that we start exploring, some of our programs. So I'm very much about self-reflection. So we talk about self-reflection, which you can do it in a meditative state if you want to. And I talk about how do we do it with journaling. If you're not somebody who wants to be able to sit still, then I say, let's write it out, just write yourself a letter. Or sometimes I just say, take the end of the day and just look back at your day and see what was the things that made you a little off or upset. And then when you look at those times that you were upset, then take a look at why.
Yep.
What were you thinking? What was your perspective on that upset? And then next thing is, how long were you upset? Because then it's starting to take a look at, okay, how am I responding? How long am I letting this irritate me? And then I go back and say, okay, can you figure out what is the connection to something maybe in the past that you were programmed that way? Does it even make sense for you? Because it is an optimal way. Now, I'm not saying you can't be upset. You can't. Because I talk to them about why do we have different emotions? Because we need to process these emotions. Yeah, it's
Yes.
for an experience. You get angry. Why do we get angry?
Because you don't feel comfortable. There's something
Right. You're
off.
trying to
Wanting
you're
to
trying
process.
to create a boundary. That's
Yes.
your borders are being crossed. Anybody gets mad when you
Yeah.
cross their boundaries. And so you need to have a certain amount of anger because that keeps your boundaries intact. And so if you don't have good anger, you probably aren't very good with boundary setting.
Yeah. Or if you're not if you're, I would even say, like, if you're all, like, if you find that you're overly angry, then that also is an example of when your boundaries are being pushed
Yeah,
and your communication of your boundaries is not being enforced,
right.
right?
So there's different ways, and that's what I tell them is we got to take a look at what's causing these things. So for me, and some good techniques I'd share that they can do in some of these instances. If they that, and again, when they're doing this review, the next thing is saying, is this something out of my capabilities? Because then you're going to say, okay, these are going to be the areas. Then we need to seek out a professional, somebody that can help you walk through, whether it be through hypnotherapy or some of these other therapies we'll talk about, to help you to be able to understand. Again, some of it you may not understand. Neuroemotional technique might be the way. We can find you a practitioner that can help you with something that may be just minor and say, okay, let's get you to that, to quickly kind of help you find, oh, what's that root cause? And then you can, or that past experience that may be hindering that or creating that response, so that you can have an optimal. Because I tell you, it's not that it's necessarily wrong,
No, they're
because
not
people, when
wrong.
they see wrong, it's like, oh, I'm defective.
No,
And
but
it's not
also, where did they come from, right? These
right.
beliefs actually came from real experiences that people have had. And if
Whether
we're
it's
not
yours
at least exactly, we have to acknowledge it, because
or
if you're not acknowledging that, look, okay, this experience really did happen, and
mhm.
from that experience, this is what you came to believe, that every experience pictures our world.
Yeah,
Why are people so positive? Because they go out in the world and they continue to have these positive experiences. But even somebody with a very positive outlook, if they have a really bad experience, that can cloud their perspective. And
yeah.
then they create a new perception.
Mhm.
So to me, it's not about faulty or defective. It's just that you had an experience that created a perception, and that perception has not been addressed or shifted
Mhm.
if it is not serving you to your best ability.
Yeah,
Yeah.
definitely. Yeah, so that's definitely the thing, is to take a look at, is this optimal? Why is it an issue? Because again, yeah, like you said, if that is not serving your purpose in the future, and it's creating a negative response of that stress response, and it's
Hmm.
continuing in this vein, then we got to say, okay, how do we stop that? So it's definitely being able to walk through that experience and find that better way through, and resolve it, so that going forward you're not continuing it. And that's where our mind body techniques are very beneficial, you know,
Yes.
and really understanding. So, I have like several shelves over here of the mind body stuff, where we got emotional intelligence. Again, I really think that our school system is failing our kids in being able to give them some education into emotional work. We've put so much book learning in front of children, and not giving that ability to express appropriately. And I think we rush a lot of times, not to any hit, because there are times we need medication, but sometimes we're rushing to the medications when children are experiencing high emotions, rather than helping them to understand their emotions. I was actually at a pediatrics convention. I was volunteering there with the Child Defense, uh, forget what the name of the association. And this gentleman, he was one of the speakers. He was an MD pediatrician, came up to our table, and he was one that was kind of speaking about the over medication of children, and not allowing them to fully understand or to process their emotions. They're just kind of, throwing them on a medication, which actually numbs the emotion, rather than allowing them to learn. Like he says, because when you take away their emotions, the bad ones, he says, you're actually taking away 50% of their life. He says, because they have to understand the negative emotions to fully understand the positive emotions.
Hmm.
And we just rush them into a medication when they're dealing with some of these hard emotions, these negative emotions, we might call them. He says, but then we've numbed them down, and now they can't really understand that. And he says, that's what I have a problem with, is when we don't address the emotions appropriately. And then later down the road, then they can't when they're adults. And so it's like we're failing our children in processing the emotions. And so that's what he's trying to work with in his avenue as a medical doctor pediatrician, is helping children through these times when the emotion is so strong and negative, to where they're not being medicated, but being able to understand and process emotions. So that's a big, I think, where there can be some issues with the mind body, can be brought in, even finding a field in the pediatrics, I think, a lot. And I think that's probably something
That's
near and dear
one
to
of the
you.
things I do. Yeah. So right now, I mean, my personal practice, which is primarily mind body medicine.
Mhm.
And then I also work once a week specifically at a pediatric practice where I see like children from infancy until I don't know until they're adults in personal practice as well. And what I would say, when I was doing my clinical internship, I actually had the opportunity of treating pediatrics specifically with I would say behavioral issues more than anything, because it's just
Mhm.
like behavior issues and emotional expression issues with homeopathy though. So
Mhm.
utilizing homeopathy, which is not shifting their brain chemistry, right? We're
Mhm.
looking at it from, if we're looking at utilizing the language of Hahnemann. So Samuel
Mhm.
Hahnemann, he was a medical doctor who created the homeopathy. What he was looking at is treating
Mhm.
distunements in the vital force. So what
Right.
is a distunement in the vital force? A distunement usually starts with an emotional or spiritual, I would call it maybe, I don't know. I don't want to. I have to come up. I'm like, when there's like there's a disturbance. There's really a disturbance in the
Mhm.
in the being. It's a person. there, or an animal, I use it for my animals as well and myself. But when there's a disturbance, whether it's emotional or like from a spiritual perspective, like or mental, a thought process, or it
Mhm.
could be an acute infection that creates it as well.
Mhm.
So any disturbance can, the energetics of that can be matched. So what I found is utilizing constitutional homeopathy, which is different than going to a grocery store and finding a homeopathic tube. I'm like a homeopathic tube, like, and it says on it, oh, this is good for what headaches or for stress. And when I do recommend homeopathics, my patients are like, well, when I got the remedy, it says that this is for nausea and vomiting. Is this gonna make me vomit? I'm like, okay. So, from a constitutional perspective, we're actually looking at the whole picture, all of the
Mhm.
symptoms, mental, emotional, and physical, and I'm matching it to one remedy, one substance. And what I found is that, like patients, whether pediatrics or adult, there is an improvement, there's a shift, there's a change. And I can give an example of a case that I've been working on. So I'm actually working on, from a pediatric perspective, a family where both of the children were diagnosed with ADHD and autism. And the parent reached out because they were looking for natural solutions. They didn't want to put their children on medications. So we did the intake. It was more of a homeopathic intake because when I talked to them, they were like, we chose you because you're very much into the energetics. And so I was like, look, for this is how I approach it. So I approach both ADHD and autism, like the behavioral, like the tics that may be present, utilizing homeopathy. And after I explained that, the parent was open to it. So we started, so they both had different remedies, of course, because the behaviors were different. How one was like kind of squirrel attention, where distracted every moment. And then the other one was more depressed and would say things. And like if you had to shift, so transitions were really hard. So two different personalities, two different remedies. And what the last conversation that we had, we did our initial and then we did one follow up. So in one follow up, transition was actually different. So mom was like, hey, we have a doctor's appointment. She said that her daughters actually did their homework because they're homeschooled. They did their homework themselves, and then they got ready. The one daughter who is really hard transitions said, "Why didn't you tell me this yesterday? Because I could have prepared a little bit earlier." But still took the initiative. And they did have, so with homeopathy, especially when it's constitutional, you do expect an aggravation. So they did have, like, when they first started the remedy, there was a moment where they kept getting into arguments, is what mom said. But then that changed. And they stopped getting into the same, they were not getting into the same levels of conflict and their emotions, the intensity. So one of the daughters was like more physically, one was verbally like aggressive, the other one's more physical. And the one that was more physical, like she just was not, she was not like, she wasn't as physically aggressive. And then the daughter that's more verbal, her aggression comes out that way, like it, the intensity had come down. So of course we're going to stay on the remedy until there's a plateau. But from a naturopathic perspective, and I know in Chinese medicine there's also herbs that when I was in Korea, I visited a hospital, Korean medicine hospital, and they treated ADHD and autism utilizing herbs, herbal formulas. So even herbal formulas can be used similarly, that, I'm using homeopathy to kind of match the case.
Mhm.
But what I'm finding is, and I did an externship in this as well,
Mhm.
that the behaviors do decrease and you can get children that are still authentic.
Mhm.
You find that they are able to adjust better. Their moods are more managed. And it's not like they're on medications that are going to change their brain chemistry. They're taking a remedy once a week that is alleviating the energetic distunements.
Yeah.
I practice the medicine. It's worked for me and I've seen it. So I'm just like, it works and it's not invasive and it's not harmful. This is like no harm, right? We're doing no harm.
Yeah.
Um, and so there are ways that we can actually help children
Mhm.
without taking away their authenticity. And I find that we're able to do that, and it takes into consideration the mind, body, and spirit.
Yeah. Yeah, I was thinking about, talking about ADHD and autism. There's a book out by Dr. Camel McBride. She's out of the UK, and she wrote the book Gut and Psychology Syndrome Gaps, talking about the connection of the gut to the brain. So kind of taking a different going body mind, you could say, and that's why mind body medicine, mind body, or body mind body. It's trying to figure out what came first, the chicken or the egg, because we know that the gut has just as many neurotransmitters in it as the brain does. And they say when the gut barrier is broken and open, the brain barrier is too, which leads to a lot of excitation in the brain, basically allowing in glutamate. Glutamate's blocked when the barrier is closed. And so the brain uses sugar to create glutamate. And a lot of neurotransmitters that are basically neuropeptide or, well,
There are
peptides.
amino acids.
And yeah, and so she works with these, which she actually started seeing the connection between the gut and a lot of psychological syndromes, especially since she had a son that had autism, and she actually you could say, put his autism in remission by fixing the gut. So you could actually say that was a mind body technique, which is recognizing that his gut had been messed up by certain and whatever it was, I can't remember for him what had initiated the gut.
Inflammation, yeah. Like
And so,
inflammatory foods and things.
yeah, so food. So she had to repair his gut. So she definitely gets into probiotics, and then utilizing mucilaginous,
Yeah,
substance,
of
or
course.
and different things like that, and repairing the gut lining, which probably got messed up a lot of, because children get thrown onto antibiotics, which then creates a definite negative spiral because of not repairing the microbiome that gets destroyed through antibiotic use, and that can lead to a lot of deterioration of the gut, which leads to a lot of the psychological syndromes. And she even talks about, I think, manic depression and a couple other issues that happen. So, that I would consider that a mind body technique in a sense, because it's dealing with another aspect that can lead us to having emotional distress, having an inability to have attention, and finding that's another connection to the mind. And so being able to realize, okay, what is this origination from the body, or is this origination from the mind? And then, being able to say, okay, what do we need to address in that case? And in hers, it really isn't utilizing medications as it is utilizing, she goes, more natural things, such as,
Yeah.
probiotics, eating a better diet that establishes the gut microbiome and reconnects the blood, or the the gut barrier, which then gets the blood-brain barrier.
I feel like
And
for
then
us, that's part of the therapeutic order, right? So
exactly.
as naturopathic doctors, that is part of the treatment plan.
Yeah.
Like already from the beginning,
Mhm.
as when I'm working with pediatrics, specifically, we don't want to go directly to medication.
Yeah.
So part of the treatment plan with every pediatric patient is establishing their health. What are the foundations of health? How do we maintain the blood-brain barrier? What foods are we encouraging? And, even in treating adults with mood disorders,
Mhm.
if we're looking at it, yes, you want to support the mucosal lining, and you want to also restore the GI, like the GI health in general, because yes, as you shared, the blood-brain barrier, if there's leaky gut, you have leaky brain, right? So I mean, that's like the very like not so, well, no, there's science behind leaky gut. So if you have leaky gut, you know that leaky brain is going to happen. So yes, strengthening the health and integrity of the gut, you want to do that. And in addition to that, having therapies, what I appreciate is having the therapies that help support. Because
Mhm.
one of the things with homeopathy is it's pushing your body to restore naturally. So even if you're looking at the Organon, which is Hahnemann's book, he
Mhm.
talks about the importance of nutrition. He talks about the importance of sleep. He talks about all of the things that we talk about in the very foundations of health. So, as a naturopathic doctor who practices homeopathy, I always want to educate my patients, and the foundation is laid. I mean, my treatment plans are very thorough and making sure that absorption, because like you
Yeah.
said, we're
Mhm.
talking about neuropeptides. When we're talking about brain chemistry, most of the things that we're talking about, neurotransmitters, they are neuropeptides. They come from amino acids. So,
Mhm.
yes, you're going to have the building blocks of these proteins and the neurotransmitters coming from the foods that you eat. And so,
Mhm.
if you're not breaking down proteins adequately and you're not getting the right sources of protein, there was a book written by, it's called Beyond the Label. It's written by, she is a naturopathic doctor, and it kind of talks about her, I'm looking for it, but it talks about
Mhm.
her journey with being diagnosed with bipolar disorder. Before she went to naturopathic school, she worked with, I think Dr. Abrams is his name. He's like the father of orthomolecular medicine. Orthomolecular medicine is using high dose supplementation, looking at
Mhm.
vitamin deficiencies and everything. And it was really huge. He was a psychiatrist who ran a psychiatric ward in Canada, and he used high dose supplements, nutrition, high dose nutrition, in order to treat his patients. So she talks about in that book foods like turkey in order to get tryptophan, which is a precursor for serotonin, right?
Yeah.
So, in my practice, when it comes to nutrition, I'm always looking at what are the actual precursors, what foods are good for that. So, I will give food recommendations, especially for pediatrics, recommending bone broths. And then also, hydration is important. So,
Mhm.
there is, and I started doing this myself because I live in a desert, even though it's by the ocean, and I'm susceptible to excess dryness, and I don't do well in desert. So I'm like always like, what did I do? But I started making my own electrolytes.
Uh-huh.
And I'm using fruit. So I get an orange, I cut it in half. I use half of an orange, a quarter of a lemon. I use coconut water, I use honey. I put some Himalayan sea salt in it, and I
Mhm.
make that. And I started taking it, and I've noticed that, I mean, I was waking up, again, the desert. I was waking up recently, my throat was so dry, it felt like it was burning. And from
Mhm.
if we're going to Chinese medicine, I'm like, oh my gosh, I'm having like excess dryness obstructing my lungs. I'm gonna, and I could see where this was gonna, what the sequelae, like what was gonna happen after if I didn't like do something about it. And then I
Mhm.
was making a treatment plan for a patient. I was like, oh my gosh, let me try this. Like, let me make this electrolyte, like recipe, and
Mhm.
that has been the game changer. Like, I am not dying of dryness. And like, that sounds dramatic, but like my fluids, they just
They're
they're staying in, and they're so sensitive, right?
staying.
And I mean, as Joanna knows, like I'm really sensitive to dryness. So, but they're actually staying in. But as you were saying that to you, this is body mind medicine. A
Mhm.
lot of therapies, for example, meditation, we see meditation, it's just we sit and think. But if we look at meditation, why do we do yoga?
Hmm.
Yoga was to condition the body. If you address the physical body and tire out the body, then the mind will follow. So there
Hmm.
is this idea when you're looking at traditional medicines and practices. Is it the body or the mind? It doesn't really matter. For someone with anxiety whose mind is going like all crazy like that, like
Hmm.
just keep going, not crazy, but sorry, the language, but it is constantly going and going and going and it doesn't stop nonstop. So, someone like that benefits from a movement practice like yoga because it will tire out the body and then the mind calms down
Hmm.
and then the thoughts come down.
Yeah.
Yeah.
Yeah, because that's one of the things I was reading it somewhere in one of my lovely long books, the mini books. Sometimes I forget who and where, but it was talking about when we're anxious and our heart rate's up, we have to move because that's adrenaline. Adrenaline is usually instigator of the anxiousness, kind of that spinning. And so you have to move pretty quick because you think about it, anxiety or adrenaline is for fighting or running,
Mhm.
quickly away. And so we don't have anything to run from. That anxiety is towards something. It's not like we used to. And so movement really helps to burn that off, which then turns down, the epinephrine and that's getting up into our brain, or adrenaline, because they're the same thing. And because it just makes this vicious little wheel that's going on. And then we have cortisol, also requires movement. And so yoga also really helps with the cortisol, which also keeps those thoughts moving, but in a different kind of pattern. And so it helps to again calm it down, burning it off so you can sleep. you know
Yeah.
and so it's movement, not as extensive of a movement as far as for cortisol burn off that you have to do as you do for an adrenaline burn off. And so it's like both require a movement, but how, what type of movement. So if you think about adrenaline rush, people that have it and you're like a boo, somebody
Yeah.
scared you, and then you're like "Ee," and you're like, what you should have done is just punch the person and said boo. No, I'm just kidding. Don't do that. But you
Please
feel
don't
like
do
I'm all anxious and what do I got to do? I said, well, somebody
Yeah.
just released adrenaline and you're going to have to go move a minute to burn it off. Otherwise, you're going to end up in a like anxious state, which can
Yeah.
make you feel jittery. And that's because that's the survival response, and that helps you to calm back down. And that's why most people tend to get mad. Why? Because that's a part of adrenaline, is the
The
anger and
fighting.
angst. It's because again somebody crossed your boundary. They said boo, and they threatened your wellness. And so those are kind of the things that we do. And so that's, as a naturopath and as traditional healers, we understand that, okay, this is what your physiology is doing. So for your mind to be in a better state, you're going to have to move. And yoga is a great way to help to reconnect and to calm the system back down, giving it that relaxed state, burning off those excess stress hormones. And then it's like, whew, I love yoga.
Yeah, it's funny because I thought about you on Friday. I had a patient, and so normally, well, it was a hypnotherapy session, and I
Mm-hmm.
could see that they still had a lot of that adrenaline
Mm-hmm.
because I know that the session was a little bit more activating, like the awarenesses were a little bit more activating, and I was like, "Have you ran lately?" And I, and so that was my prescription. It's like, okay, like go run because that's something that is important to that person. And so I had them run. I invited them. I actually invited them to run after our session so
Mm-hmm.
that they could kind of release the excess emotions just because they have
Mm-hmm.
to go somewhere, like you said. For
Mm-hmm.
me, it's dancing. If I'm not doing yoga, I'm going to go and dance. I'm going to get that out. But one of the things, if you look at animals, and I know I mentioned this before, animals shake.
Mm-hmm.
So there's this shaking.
Mm-hmm.
So one of the things that I started like incorporating, and they do it, I know we do it in a warm up for Tai Chi, it's just to
Mm-hmm.
shake your hands, shake everywhere, shake, 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 to help loosen out and release that emotion, the emotions that have built up. Yes, I know. And it's so helpful because again, when you have that kinetic energy in the form of
Yeah.
adrenaline in your body, that energy is trying to get you to do something. It
Yep.
was usually fight or flight. You're fighting for your life or you're running for your life. And
Hmm.
since we're not doing that to the same extent, we
Hmm.
have to do some type of activity to get
Yep.
it out, right?
Hmm.
And that's part of, I will say I love my hypnotherapy practice because the emotional release work that I
Hmm.
do is
Yeah.
physically demanding, is physical in nature to help
Mhm.
release the energy. So
Yeah.
it's beautiful.
Yeah. It brought me up the other day. I watched this old Carol Burnett skit with what's his, Robin Williams, and he's this unfortunately eccentric person seeing her at a funeral.
Mhm.
And he was bothering her, but what's coming, I mean, they do it in a funny way, but it really kind of comes into this context because he's like, do you want a keen? And she's like, what is keening? And he says, it's the Irish way of mourning. You release this, and he goes into this moaning, and it's, he's being hilarious, but it's, in a sense, that's, he's trying to have her to fully release her grief, helping the body to release some of that energy of grief, because it's overwhelming. I know people that kind of harbor their grief a lot of times end up with lung conditions, right?
Mhm,
Which,
mhm.
of course, the throat is a lot connected to the lungs, along with the nose in Chinese medicine.
Mhm.
And and so it was he was trying to get her to release her stuff, and she's like, and finally at the end she starts keening with him, and then she ends up really crying. Of
Yeah.
course, for them it was more in a comedic way, but at the same point I was seeing that kind of what it was is really being able to allow somebody to have that free space to feel open enough to really allow themselves to express the emotion, which is where we've gotten in our society. We've gotten so blocked in that we don't allow ourselves to really express our emotions and really allow our body to release the emotion through, especially again, like we were saying, going to run to release that energetic emotion out there that was there. Because when you're fearful, you run away or you hide or whatever. And we've allowed ourselves to get blocked in. There's only certain emotions that we can allow ourselves to kind of express and sometimes overdo. Anger tends to be one that people are okay, acceptable with in a sense, but then it gets too much because that anger sometimes becomes displaced sadness, displaced fear. Um, and so it can become aggressive, especially one out of fear or um, what was the other one? Yeah, mostly fear, I think, can be the most deadly. Anger, because fear is a fear for your life. And so sometimes it goes a little too aggressively. But, there's different ways that we can, I was reading, I think it was in the Five Elements book or one of the other ones, talking about how people shift away from the one they think is an unacceptable emotion to a more acceptable emotion. And unfortunately, it dissuades and that leads to the illness. And so being able to help somebody through the proper emotion so that they don't have that emotion sitting underneath creating those stress responses. I like to
Yeah.
say, go to that nervous system conditioning to the proper way, right?
Yes. No, it's so like I'm glad you brought up Chinese medicine. One of the like I guess old, very, I would say like the wise sage ancient Sun Simiao.
Uh-huh.
There's stories about how he kind of he would elicit an emotion in patients. So if he knows that someone needed to be, if anger, for example, we know if a liver disharmony is created by anger,
Mhm.
or if somebody is afraid, we know that there's kidney disharmony. So he would look at which emotion is suppressed, and then he would trigger that emotion. Whether it's making somebody so angry that they finally blow up on him, or if somebody is suppressing their tears, he will
Mhm.
say something that will make them emote. But if
Mhm.
there's like a need for more joy, he would do things to make them laugh or make them what brings out that joy,
Mhm.
because each of the emotions, as we learn in Chinese medicine, each organ has an emotion that's associated with it. And if you can
Mhm.
address underlying emotion, then you can actually liberate some of the physical symptoms and the distress that the
Mhm.
patient is in. And so it's, I love that. And there's so many ways that we can help patients. And in Chinese medicine, I know, like, because I'm in school, it's so easy for me to get acupuncture. And when I am overwhelmed with emotions and I go in, I'm like, oh, I'm dealing with this stressor. I know that I get my Ren 17 and my
Mhm.
Ren 17 needled, and then I'm like, I feel the energy, and then I come to tears. And in that moment, I'm very relaxed. What I love about it, and it goes back to highlight, I guess, what I was talking about early on with
Mhm.
acupuncture, is getting in that relaxed state. And
Mhm.
then from that relaxed state, like, I can feel, I mean, I'm sensitive to what's going on in my body, but I can feel something coming up. And instead of fighting it, I just acknowledge it and let it come, right? And with mind body medicine as a whole, I think is normalizing our emotions, normalizing and creating safe spaces where
Mhm.
people can accept what's going on through feeling, acknowledging, and expressing,
Mhm.
right? I know in my practice, that's really the work that I do. And then there's stuff that I do send patients with to, or clients with, as homework to to support and reinforce. But really, if if suppression in general is a major contributor to disease, we see it with stress, because our
Mhm.
minds and our bodies, they see stress, whether it's physical or emotional, the same way. So when you have an emotional stressor, if we're not in a position to acknowledge, feel, and express, then we're not really dealing with the root cause, if there is a mental, emotional, or a spiritual nature to the disease, right?
Mhm. Mhm.
Yeah, yeah, that's something that I really
And
find.
yeah, that's, then that's the missing link a lot of times in Western medicine, why, there's a lot of pain issues and problems with pain management. Because a lot of pain, like we talked about earlier with utilizing the neuroemotional technique, that a lot of pain is really the psychosomatic. A lot of people say your mind is your body in a sense because it's connected. And, there's different there's it's called essential elements. It's actually in aromatherapy. They actually have some uh, aro- um, they utilize essential oils for emotions, and they have those emotions associated with body parts, and it's pretty interesting how they've created, and it's very similar. And there's another technique called touch for health. I think it was a Dr. Fee. He started that one. He also has where your emotion is in certain parts of your body as well, in certain muscles. So you can go through it that way. So there's different people have mapped different ways. Of course, we have you have all the microsystems in the body. Well, they have different ways that they look at how emotion moves into the body, creating pain in certain areas based on those emotions. So if we don't deal with the emotion that's triggering these pains or these, responses, you're going to always have it. So you're never going to completely resolve the situation if the root cause is emotion. And if, of course, in Chinese medicine, which I love, when I go through in my treatment of disease class, which I'm doing currently, I'm in the second one, just before going into clinic. Yeah, they talk about in etiology. They have the different areas, and it really confirms why I really focus on what I call the foundations of health, nutrition, fitness, and stress management. And you'll find all three of those topics all the time in Chinese medicine in the etiology of all the diseases, or their what they call their diagnoses, which isn't like we have hypertension, da da da. It's like, liver chi stagnation or whatever. And which, of course, that one we know is always emotionally driven.
Oh,
Stress
ADHD
tends to be it.
stagnation.
If you have liver chi stagnation, no emotion is there.
Yes,
And
yes,
so usually the stress, of course, is in the emotional realm is mostly where we see what we consider stress, and that's where they talk about it. They talk about overworking, overthinking, da 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 da. They have the emotional piece in there. They have the nutrition piece in there. They have the fitness in there. You're not moving enough, or you're moving too much, or you're doing too much of this activity. And then there, of course, you're eating too much greasy food, you're eating too much dairy food, you're eating too much red meat, depending on who, that's they've seen associated with the different types, like, of course, stomach heat or a spleen chi stagnation or spleen chi deficiency. You're eating too much cold things, you
yeah,
know.
yes, it happens a lot.
Yeah. So, these are the things that we have to recognize, like you said, is that if there is a root cause, is the emotional piece that has to be addressed, or we can't take care of it. And that's really a strong piece in Chinese medicine. And that's why, I said at the beginning, it's a holistic approach. And that's very much a Chinese medical approach. And I do believe it's in many of our traditional, even Ayurvedic medicine and some of the others that really have never separated the mind and the body.
Yes, for sure. No, definitely. You know what comes to me, yes, when we're talking about a lot of the when we're talking about mind body medicine, it is amazing for pain. It's
Mm-hmm.
amazing for not just pain, GI
Mm-hmm.
disturbances
Yeah, definitely.
and headaches, and I mean that's a pain. But even
We kind of separate it.
I know constipation and diarrhea we see a lot, but also like we
Acid
like
reflux.
exactly acid. Oh yes, yes. The one of the first times that I got to it was experimenting while we were in school with it was the second mind body. I was like, I really want to do this mind body script for hypnosis, and acid reflux came up, and it was interesting because it was an experience that took the client, because they're our client at the time, back to the womb, and
Mm-hmm.
the cortisol and the adrenaline rushes of the mother was impacting the
Yeah. Mm-hmm.
and that person noticed like later on that certain triggers were emotional, specifically a parent. When a
Mm-hmm.
parent was reacting in a certain way, it would actually trigger the reflux even
Mm-hmm.
after we'd worked on it. And I do see that, right? Because if, especially like in that case, it was in the womb that they were first exposed to conflict, and
Mm-hmm.
the mother's physiological response to the conflict resulted in her having this burn. But that burn continued because when there was discord in the home, if there was any really strong negative emotions that were traumatizing, because they are traumatizing, within the parents, it would actually trigger the reflux. And not just with the parent, but anytime that they were made to feel that way. And
Mm-hmm.
it's interesting because I've seen it, car accidents causing pain and the emotions and the fears and the helplessness that one may feel. So, utilizing therapies that allow you to go back and do a corrective experience
Mm-hmm.
allows for the release of the emotions, because that gets stuck in our bodies. Releasing those emotions, and with the release of the emotions, pain actually goes away.
Mm-hmm.
And to me, like the first, that actually was like the first, my first training in hypnosis. That was one of the sessions that I did. Somebody was like, oh, let's do this. It was a car accident, and their pain and their anxiety came from the same incident. And it
Mm-hmm.
was fascinating to see that really pain can be, it can be an emotionally driven experience, especially when there's helplessness.
Mm-hmm.
Helplessness can create, so like, I call it fragmentations of the soul. And the fragmentations of the soul, where as a human being, our soul breaks, pieces of our soul breaks, dissociates from are whole
Mhm.
due to an experience that we're helpless. There's so many things that can cause it, but like that helplessness I've seen in different forms,
Mhm.
where that is where you have to go back and get that. It's like the soul retrieval, as they talk about in like shamanic practices. Going and
Mhm.
correcting those experiences allows for, okay, what did you do you notice if a part of you was lost at this time? And I see when the reintegration of that part, that soul part, where it's like
Mhm.
whether it's like being empowered or whatever it is, like let me get my voice back.
Mhm.
When person puts their voice back into their physical energetic body, the pain associated with not having that voice or whatever the experience tends
Mhm.
to be minimized, or it's alleviated almost completely, I would say even completely,
Mhm.
by those corrective experiences. So it just supports what you're saying with the emotions being a major contributor to our pain, and the importance of providing
Mhm.
corrective experience so that
Mhm.
pain can be truly relieved and not just managed.
Yeah. Yeah.
Yeah.
Yeah. So, I got to watch, you were at the same, uh, I think we may have talked about it once at the AANP conference, and they did the fascial release, and the gentleman was in a car accident. You brought me back up, and when she released the fascia here around his chest, which was going in the wrong direction, he just started crying. That trauma emotion from the accident was being released at the same time she was releasing the fascia, which, there's so many different ways of accessing those emotions because they're stored in the body, not just the brain. And that's why that, they talk about that, when you're releasing an emotion, you'll also release it from your body. And sometimes if you don't have it in the forefront, sometimes going into the body where the pain is and finding, that tension that's there, when you release that tension or help them to release that tension, then usually the memory, it rises up, and they're,
Hmm.
can either experience that emotion again and allow it to, and the practitioner can help them, as we say it at school, hold the space for them to allow themselves to go ahead and have that experience, that emotion, and fully release it and feel that they're in that safe space to do that. And that's another form of mind body medicine I've seen is the myofascial release, where sometimes the emotion is housed within that connective tissue, which is very much associated with the nervous system, because that's kind of where the nerve endings lie, is in that fascial layer. And I've seen it. That's another thing I practice, as far as not practicing in my coaching. I'm still practicing it in school as a student. Is the myofascial release and the emotional piece that's done through myofascial release. And I look forward to being able to utilize some of that when I complete, because I've seen it work, with my peers and family that I'm practicing on, to continue to understand the technique and work it, is being able to help them to release that emotion that's stored in the body,
Hmm.
as well. So that's another mind body technique you could say that's utilized, is body work.
Yeah.
Mhm.
I usually like refer, because I my training is also in body work, but now I've started referring
Mhm.
people to get body work after our sessions, because like you said, the emotions get stuck in the tissues. So it's
Mhm.
kind of like me requesting, hey, do you want to take a run, to kind of
Mhm.
help move the body and help them to relieve some of the emotions, but physically releasing out of the body. Again, that's another way, whether it's physical body work like myofascial release, but also
Mhm.
acupuncture is a tool for myofascial release. So I would recommend, so I started partnering with, like, I try and do referrals to acupuncturists or massage therapists, so that patients are getting that full level of support, so that
Mhm.
they're getting the physical release out of the tissue. And I actually had one of my friends, we were talking because they had an emotional experience, a really stressful experience, and they got a massage, and they
Mhm.
did not a lot, the emotions came up, but they suppressed them because they didn't want to be that person on the table. Now, I'll just say, as a massage, when I went through massage school and as a massage therapist, if somebody has an emotional release on the table, I am happy because that means that the therapy is effective. So I encourage people, if you feel yourself getting emotional, allow yourself to have that because massage therapists are trained to hold space, as you said, for their clients. And I think it's a very important that that emotional release, if it happens in a space where it is therapeutic, even it's supposed to be relaxing, that you allow yourself not to suppress it because with that suppression they ended up getting, like you said, that you get a cold or a flu because of the lungs from a Chinese medicine perspective, right? So if the chi, the energy of the lungs is blocked, then it makes it easier for pathogens to stay there and the immune system is not able to work effectively. And so unfortunately, like my friend was sharing that they were not feeling well after the fact and they thought it was weird and I was like, no, like you blocked the you had an opportunity to release the energy, but in blocking you're causing chi stagnation, specifically not to the liver but to the lungs. You're stopping the flow of energy, and in stopping the flow of energy, the cells and like especially the lungs, that's wei qi is a part of that. Wei qi is the defensive qi, that is the immune system. So if you're not allowing the wei qi the qi in general to flow, then it impacts the ability of your immune system to defend itself because our first defense is really the skin and our mucosal lining. And if that is not being defended well with our immune support within our body, then you're more susceptible to a pathogen or something else. So when you shared that, I was like, yes, like body work is amazing.
And you think about it, you were talking about yoga, there's somatic movement, right? That helps with removing emotions. You can do movements that open. And some people even find when they're doing yoga, when they get into a certain pose, and they're like, I don't like doing that one. It always makes me want to cry or whatever. I'm like,
The
then
heart
you have
opener.
emotion stuck there and
Yeah.
it's opening that space up so that it can actually be released. And so they call that somatic movement, but it can be done with many of these types of therapies, so or excuse me, movements that are mind body kind of connective. And so there's one that's specifically called somatic movement. I've seen that one, and they do different movements that's supposed to open the chest or the back and help to release any emotion that's stuck in those locations. But like I said, even with yoga, it is very much can be a therapeutic in the release of emotion, not just really, getting rid of those, like we talked about earlier, the cortisol and the adrenaline and helping the body and calming the mind, but it actually can help in that emotional release and processing sometimes as well in certain poses. They can really be very therapeutic in opening the space for you to release.
Yeah. Again, it's chi flow, right? The flow of prana. In yoga, we're talking about prana, which is synonymous with chi. So yeah, like I know with heart openers especially, and then also working in the hips. When we're
Mm-hmm.
doing flexor work, you see a lot of emotional release when you're working with the hip flexors, especially when we're doing like for female bodies with wombs
Mm-hmm.
because so much trauma gets stored in that area, in the sacral chakra area, but in the womb. So when
Mm-hmm.
we're doing movements that open the muscles, allow the muscles to relax the tension that has been there, and we see it like people who are they're hyper flex, they're forward flexed, and you see that they're walking more bent forward, and it's usually because there's so much tension in their hip flexors, and when that is opened and released, then you notice that there's a lot of emotions that are stored there. And I've seen that as in yoga, but also as a massage therapist
Mm-hmm.
doing myofascial release specifically in the hip flexors, in the pelvic area.
Mm-hmm.
That's where it like it can get very emotional because of all that is stored. And the
Mhm.
population that I've worked with doing that in the ND clinic, naturopathic clinic at our school, when I was in school, was the postpartum.
Mhm. Yeah.
So one of my patients I worked with was postpartum and supporting with, so they came for wound support, but then also because of the trainings that I had, we were able to go a little deeper and kind of address a little bit of the emotional trauma that pregnancy can also result in. And my mom actually brought this up because for my hypnotherapy, one of our trainings we always look at our birth issues and having conversations with our parents around what happened in our birth. And it's funny,
Mhm.
my mom was like, "Oh, I was in this amazing, like highly," and what did she say? She felt heightened and enlightened and all of these things. But the area where she had the hardest time was actually navigating the medical system because she
Mhm.
wanted me to be a vaginal birth after C-section. And she
Mhm.
was getting so much resistance that she was like she's fighting the system so that she could have what she wanted. Unfortunately, it didn't happen because I had my umbilical cord wrapped around my neck because I mean, it was like not I think it was just so much stress going on with her navigating that.
Mhm.
But it was interesting because throughout her pregnancy with me, she said that was her only stressor. And I know when I worked through my birth trauma, being a C-section born baby, like
Mhm.
there are things that happen, like because we're not coming through the birth canal, we're not getting the vaginal bacteria, the microbiome of, and when we have our first breath, usually there is a little bit of the swallowing of the microbiome from the mom. So I didn't get that. And there's also a correlation between C-sections and developing celiac and
Mhm.
other autoimmune conditions, specifically around the GI tract.
Mhm.
So when we're looking at like how these experiences, because those contribute, like even, the birthing experience creates a level of emotional trauma that may
Mhm.
manifest in different ways. I mean, for me, like, yeah, I have to be really diligent about what I eat because my body cannot tolerate certain things and it creates pain. But in being mindful and aware of how my birth increased
Mhm.
susceptibility to certain conditions. Something as simple. I mean, how many people are getting C-sections,
Yeah.
right? So
Two. It's supposed
a
to.
lot. So when we're like looking at all of those things, it's like these are the things that like as a practitioner, and it's not about shaming people's decisions. It's about having conversations so people are aware when you make said decision there can be these consequences, and if that's a choice that you want to make, these are things that you can do to support not just you but also
Mhm.
developing baby to minimize some of the physical and emotional distress that may come.
Yeah. When you brought that up, it brought me to another type of medicine that you could probably categorize into mind body medicine, which is New German medicine by, oh, I just lost his name. Dr. Hammer, I think is
Yeah.
his name. And he gets into the birth trauma. The book I was reading that was kind of getting into it, it was kind of interesting because I was like, oh, what about my birth trauma? And I was like, oh, I know what my problem is. And because I always am like, why can't I ever get what I want when I want it? It always seems to be delayed. Well, what's funny is my mom went into labor with me in November of 1979, but they said I was too small and not able, so they stopped her labor. So I was delayed on being born until December 29th. It's like, oh, I wanted to come in November. I hated my birthday in December because it's in between Christmas and the holiday. And that's my problem. There's my birth trauma. That's why I think I can't never get what I want on time and everything gets delayed.
Because you
It's because of
yeah,
my birth.
I
But
came
he
in
was
fighting, you came in delayed.
I came in delayed. But he was talking about um, people that are born cesarean, that a lot of these children think that they always have to be helped out,
Hmm.
because they had to be helped out of the womb. They didn't get to do the usual pathway, and so then sometimes they have to deal with the fact that they think that they have to be helped out subconsciously, and so they're looking for somebody to help them all the time. I don't necessarily see that with you, but I have seen it with others. And it's quite fascinating that he's like, this is, and then he was talking about the really messy kids. He said that sometimes if they had a messy birth, they feel that they're only comfortable in a messy situation, so everything tends to be a mess. And you're like, why is this kid keeping us all messy? It's because that's how they were born, and so you have to take them back to the birth trauma. But he talks about all these different ways of trauma. So his actual medicine is really kind of stemmed from cancer and his experience with cancer. He ended up with testicular cancer after his son was killed, tragically, from an accidental gun going off, and he was killed. And shortly after that, he ended up with testicular cancer, and somehow he connected those two with his body trying to compensate for his lost son by producing, you could say, more seed in the testicle. Anyway, and so he started looking at trends of people's cancers in association with a trauma. And
Hmm.
if he could get them to recognize their trauma, that he was able to help them to overcome their cancer.
Hmm.
Um, and it was different. And he actually pinpointed, just like I was talking about with the essential oils, and even in Touch for Health, he also has parts of the body that are associated with certain types of trauma.
Hmm.
Um, and he saw the patterns of the traumas. And so I was actually, because I'm one of these people, does all this stuff line up? So I would go to this one, and then it go to his, and the other his, and they'd be very close. None of them are 100%, but they're pretty close to having similar types of getting them, where all of them have a similar thread with different parts of the body. But it's pretty fascinating. So he has another way. There's a lady that practices his medicine up in Canada, up in Ottawa. She actually has a clinic, and I think she has a retreat, because when you're going through cancer, it's very, she makes sure that you have the support, because she actually even has the people call her if at any time they're having issues, because there's crisis phases, just like with homeopathy. You have what's called a healing crisis, which we have similar things even in Chinese medicine. They talk about the healing crises is letting people know you'll get worse before you get better, because it's the body overcoming the you could say the wall or barrier of energy, and it's jumping it over, because your symptoms is the body trying to get back to equilibrium, but it's stuck. I call it kind of like revving over the hill. It's like rrr, rrr. It's never making it over. But when you get the energy in there, because you figured out the problem, or you gave the homeopathic remedy, or you took acupuncture, you took your herb, you've given the system the energy it needs to go over the hill to being healed. And so you're going to get worse as you're going up the hill, and then zoom, you're going to get better. But people get scared, and she talks about that fear which creates, and that's what he talks about. It's not that he doesn't believe in metastases per se. He says it's another trauma of the trauma of being told that you had cancer, and that fear, that other trauma, creates another one, which is why it tends to go to the lungs a lot of times, or the kidneys, because of the fear trauma that goes to it. That's his, of course, hypothesis
Yeah,
and theory.
it depends on the cancer, right? Because you have the liver, so
Yeah,
the liver would probably be more anger, but you
right.
have
He has.
so many forms of metastasis. And I
Mhm.
will say, because from a lot of, like, there's so many names for the work, but
Yeah.
we do similar work, right? Addressing
Mhm.
emotional contribution to dis-ease can be, some people are like, I specialize in, for German new medicine, it was cancer, but there's some of us that the specialization is in our modalities. And I feel like that's how I practice. My specialization is in homeopathy and hypnotherapy at this
Mhm.
point.
Mhm.
Those are like really, and of course, like naturopathic medicine and herbs.
Mhm.
But the condition that comes, it's looking at the individual, addressing, like you said, the mental emotional contributions, because depending on the cancer, there usually is a mental emotional component. And some of
Mhm.
the research, just because cancer is a field that I have a strong interest in, some of the research that I've seen from the hypnotherapy perspective looks more at emotional suppression in general. So, like breast cancer, there's a history of suppression, and some would argue suppressing one's own needs, putting
Mhm.
everyone before the self, and
Yep.
that's one of the
Mhm.
psychopathology, right? If we're
Mhm.
looking at the psychopathology of it.
Mhm.
But every I got into that because of multiple myelomas, so bone cancers.
Mhm.
And there's an association of bone cancers and grief, emotional grief,
Mhm.
and living in grief for a very long time. And if we talk about, and it's like lifelong. And when I started out, it started like before I got into school, I had a couple of people who were impacted by cancer, by specifically bone cancers, and I would visit one of them, well, two of them, in the hospital, and one of them passed away before I got into the deeper training. But the second person that I just kind of maintained a relationship with, when I found out about that specific, the emotional component, I sat down and we had a conversation. And I asked because I was just like, okay, like this is what people have said. What do you find? And they shared with me that they felt just they were grieving their whole life. I mean, like I'm not getting into people's really like sad experiences in life and how there's abandonment, grieving over abandonment, being isolated. There's so many things that can create these patterns. And if they're not healed, then it becomes harder. Like that, you don't see. There's research talking about spontaneous regressions, right? But like what I've seen is if the emotional contributor does not get addressed, then you see that they have a hard time getting into remission in their
Mhm.
immune system. She had like a bone marrow transplant. Her body rejected it. She had multiple just interventions over the years, and her body rejected them and rejected them. She didn't want to die,
Mhm.
so she stayed alive, but it was like one grief after another because it just was like my body's even rejecting my treatment, and I'm suffering. Like I live in a bubble. Like if you come and visit me, before you had to use PPE before COVID, so I knew how to do that because I would visit her, and it's like
Mhm.
protecting her and all of these things I learned. But I also got interested in utilizing, so a lot of it is hypnosis for chronic illness is what they were, the hypnosis for cancer, hypnosis for chronic illness. So that's why I say for me it's mastering mind body medicine using hypnotherapy and clinical hypnosis, and then also becoming better at utilizing other tools. Right now homeopathy is the modality that I use to support to support the body, to push it, to give it the stimulus so that it can heal, because
Mhm.
we can put the nutrition and we can do all the things, but it doesn't mean that the person's body is going to actually do the get over the hump. But
Mhm.
for what I found, especially in our modern society, where it's not like back in the traditional times where life was very simple. We have EMF, we have other stressors, we got work, you got to survive. You own your house, but if you don't pay your taxes, you don't own your house anymore and you can be homeless. Like there's so many stressors that modern life contributes to, especially living in America. And because of those things, I have not found that monotherapies work as expeditiously as doing a combination and layering. So I will help with nutrition, but I'm going to nudge your body with homeopathy, and then I'm going to do hypnotherapy. Or I may use, if it's not homeopathy, herbs, whatever it is, but I'm still going to do some type of mind body medicine, because if we're not addressing the mental emotional issues, if we're not connecting you mind, body, and spirit and aligning you, I have not seen people improve. And when I went to Hawaii for 3 weeks, when I was in Hawaii, it was a residential naturopathic clinic. So patients came, they flew to Hawaii and they would stay. And the doctor who, her whole practice was actually treating mental illness, addictions, but also cancers, utilizing naturopathic medicine. It was in residence so that she could see how people were doing, because that healing crisis needs to be managed, right? And from a therapeutic perspective, if you're not managing that, then you're putting your patient at risk. So that's why she had the in residence practice. And in her treatment plans, she, like me, always addresses the mental emotional, because for her, if you're not addressing the mental emotional, then the patient has no chance of getting into remission and staying in remission. And if you have a chronic illness like cancer, treating the cancer is one thing, but preventing it from preventing a reoccurrence is another thing. So being able to address the mental emotion allows for remission to stay lifelong, right?
Mhm.
Or prevent the reoccurrence. Or if there is a reoccurrence, you're able to address the new, whatever the new emotion, what is really going on from a soul level that is not, you're not in alignment with. Because when we are not in alignment with what we are going through, then we're going to have, like I said, those soul fragmentations, and that is part of the disease pathology.
Mhm.
Yeah.
Yeah.
Yeah. Oh my gosh, this was such an amazing conversation. I feel like we did get to talk a lot about different therapies and
Yeah.
how they are interconnected, because the goal ultimately is the healing, right?
Yeah, treating that whole person. That's what the thing that I get, well, what I love about this conversation is, and this is very much the mindful piece of healing and wellness that gets missed. And that's why, we went into the traditional natural medicine approach, is because we saw that missing piece there. Of course, when I first started, I didn't see the full picture of it, right? I just knew that I wanted, I love the nutrition, right? And I was
Yep.
like, oh, this piece, I gotta go there. And then I got exposed to the mind body piece, and I was like, wow. And then of course, when I went into doing, when I left out and went into health coaching while I'm still trying to finish my degree, I could see the end result. I could get people eating right, I can get people fit. And the last thing was the stress piece, which is the mental emotional piece. And that's the toughest one to get and get people to understand it, because we still have to bring those two in the Western world back together. I don't think it's quite so much outside of here and more of the Eastern medicine, but definitely in the Western is saying this is, and they're starting to see it. People, when I've worked with them, like, oh, that's the tough one. I said, yeah, so we got to really work on that. So yeah, there's so many ways that it can be approached. It's just getting the knowledge and getting people into finding those practitioners, and
And also
hopefully
being open to it, right? Because
through that
again,
too.
if
Yeah,
you're
definitely.
used to the conventional model,
Mhm.
and
Yeah, yeah.
you're, oh, I'm gonna go, like, I'm going to an acupuncturist, or I'm gonna go see a naturopath. There's some
Mhm.
people who they resist what
Mhm.
is unknown to them.
Yeah.
So it's being able, that's part of the reason why I love that we agreed to do this, to kind of share
Mhm.
about our field, so that people can understand a little better how
Mhm.
we're able to utilize these tools to support our patients, right? Because we're treating all kinds of, like, I know I treat all kinds of disease or disorders, whether it's mental, emotional, whether it's pediatric, emotional, behavioral, whether it's genetic contributors that occur. when there's a nervous system dysregulation, and nervous system dysregulation occurs in everything, there that means that I can support the person. They
Yes.
just, if they're open to it,
Mhm.
so I really appreciate that. Yeah, there is a lot that is available. It's not even there's a lot that is available to people, and being aware and knowledgeable that there are practitioners who are trained to
Mhm.
support you, your whole person,
Yeah.
holistic.
Hope. Yes.
That's all we are trained in. We're trained in using natural therapeutics to treat disease. And
Mhm.
so you have that the reality is there's options. And the more that we can educate people on the options and talk about the things that we do and what we offer and how,
Mhm.
whether it's through coaching, whether it's through clinical practice,
Mhm.
those options are available
Mhm.
to people to really get the whole mind, body, and spirit healing holistically as one.
Right. I don't know if we'll ever see that day in our lifetime of getting all the medicines under an umbrella of running. This is really how healthcare should be run, like we talked about in our therapeutic order podcast. But that's where we can get the mind body medicine back. It's part of the whole umbrella rather than, trying to help people find it because, they're getting to the point they're frustrated. People come to us that are frustrated because they've been trying to get healing and they've only gotten so far in Western medicine because there's still the gap in that mind body piece. And of course, it's not taught in medical school so much. I mean, they're taught psychology and they're taught psychiatry, but even in that, not getting that full, like we get in natural medicine and definitely in Chinese medicine, that full connection that is there. And so I know it's starting to seep in, definitely in some functional or in some integrative practices. It's starting to, they understand, you could say, the physiology of it, but there's a little bit more that comes with it. But so yeah, hopefully we can expand this topic maybe, or I don't know where we're heading into the next podcast, but
I think we could revisit it. There may be some things. I did send out some asking if there are people who have any idea, like any thoughts of what they would like to hear from us or hear about, then they can share that as well. And we can we can adapt to those ideas as well. But
yeah.
yeah, this has been a really, really great conversation. And I'm looking forward to our next episode where we are going to continue the discussion on a new topic. I don't think we have a specific today, but I did have some interest that was brought up. So we'll be tuning back in a couple of weeks with the
Yeah.
next episode. And thank you so much for listening and tuning in.
Thank you so much.
Have a good night or good. Have a good rest of your day or evening.